today. What a great day. I also want to echo the thanks to the to staff and our chair, Katie, for helping to shape this agenda. I think there's not a more perfect topic that we should be focused on. First, I just want to say thank you to all of you. The Delaware Cancer Consortium is really such a gem for us. And when I talk with my colleagues in other states, there's envy for this amazing group of people that we have that have been coming together for years. And I'll just remind everyone that certainly prior to my time in this role, Delaware was number 2 in cancer, and because of all of you, we're now 16th for cancer mortality, which is a huge step forward. It's huge progress. No other state has seen such improvements in such a short period of time, and this table of really committed, really incredibly brilliant people who have helped bring us to this point. We're just so grateful to all of you and to all of you in the room. But lung cancer is our leading cause of cancer mortality. It is 14% of our cancers in Delaware, so 14% of our cancer incidence is lung cancer, but 30% of our cancer mortality is lung cancer. So it is right that we are focusing on this comprehensive approach to addressing lung cancer. A lot of great work has gone on. I think Delaware has a great reputation in the work that we have done in tobacco. Michelle, thank you so much for being here today and for sharing insights around tobacco prevention. Our comprehensive tobacco control program is so important to us, and Fred Gatto and Lisa Moore, thank you so much for your longtime commitment, and others on your team for this work. When we talk about comprehensive tobacco control, we're talking about prevention being so key, and that means prevention of youth initiation especially, but also just to increase awareness. When we talk about comprehensive tobacco control, we're also talking about the importance of cessation as well as policy initiatives that we know can have such an important role to play. And then, of course, when we're talking about lung cancer, screening and treatment are so critically important. So I'm going to touch base on all of these. First, about what we're doing in these areas, but then, data geek that I am, I spent some time in the last couple days really thinking about what's important for us as far as focusing our efforts. So around prevention, we do have some really good work going on, and thank you to the Lung Association for many years being the lead in working with our youth, our young adult populations, increasing awareness, really getting youth to advocate for tobacco control and just increasing awareness among their peers. It's a great program that we have here, but as you heard from Michelle, and I think we're all so very aware, much of the progress that we've made has been reversed recently. I was recently meeting with some fifth graders and talking about epidemiology and the data around tobacco. And even in fifth grade, they all know what juuling is. They all know, and they know that it's happening in the high school. They say it's not happening in fifth grade, but they know that it's happening. They know people who have juuled, and many had even seen juuls. And they were asking, well, why don't we just ban tobacco? I don't understand why we can't just ban tobacco. And I was like, that's a great idea, and maybe you guys should help, lead the way so that we can ban tobacco. But we also brought in a little bit of their, social studies around politics and agricultural history, and I think they didn't fall asleep. So hopefully this was helpful. But around youth initiation, clearly we have a lot of new work to do. And so we're also so grateful for Tobacco 21, which the governor is going to talk a little bit more about in a few minutes. But also we're doing work Our team is doing work, and we did focus group work with youth to better understand their perceptions, and we're going to coming out soon with a new social marketing campaign to, again, try to drive home what many youth don't understand is that it's not harmless water vapor and that it contains large amounts of nicotine and will lead to a lifelong addiction to tobacco. So lots to do there. On the policy front, Delaware has often led the way, and again, I take no credit for this, and many of you in the room were, spearheading our Clean Indoor Air Act in 2002, which we know has been so important for driving our rates down. In 2015, we were able to add e-cigarettes to our Clean Indoor Air Act, which was a great step forward. Also taxation, which is an area where we know that policy can make a difference. Let me touch on screening. Screening for Life is a program, a well-established program that we have here, largely federally funded, although we do use some state dollars to help support Screening for Life. Talking to Dr. Grubbs this morning, we're really proud that we have hit the ground running with lung cancer screening in our state. We know we have a lot of work to do, but we also know that we've got a lot of the puzzle pieces in place to really make this a great initiative and really reach those who are high risk and help get them screened and help prevent their demise from lung cancer. And of course, I have to mention the Delaware Cancer Treatment Program, which again, folks in this room were really critical in designing. And although with the Affordable Care Act, we found less people who needed the cancer treatment program, we still have plenty of participants, and those are especially individuals who are uninsured or have high out-of-pocket costs and need the help so that they can get the treatment that we need. So we have a lot of good things in place, but we have our work cut out for us. As it relates to tobacco, we do want to get to zero. That is our goal. And so we do need to continue with these prevention efforts. Policies like T21, we need to keep thinking about what's next on the horizon to continue to drive down our tobacco rates. When it comes to lung cancer mortality, you know that we've got these criteria around high risk. So individuals who are 55 to 74 years of age, who have a smoking history equivalent to a 30-pack year, those who currently smoke or have quit within the past 15 years are among those who would meet the criteria. However, in looking at data, I think it's really important that we make sure that we are doing special outreach to groups where we see higher tobacco usage or higher mortality. And so our efforts need to, for sure, focus on individuals who have lower educational attainment, individuals who are lower income, individuals with a disability, individuals, and we've talked about this before at a previous consortium meeting, with mental health disorders and especially substance use disorders. Also, we see really high smoking rates among pregnant moms. So higher than the nation, about 10% of our pregnant moms are smokers. And we're recently looking at our newest data around neonatal abstinence syndrome, and about 90% of those moms are also smokers. And additionally, we know that actually smoking is associated with opioid use disorder relapse as opposed to, success in treatment. So that's an area where we need to focus. With minority populations, we tend to have less success with cessation. We need to figure out why, and we need to make sure that we are ensuring that minority populations in our state are getting the referrals to our Great Quit line. So that's one area that we need to make sure that we focus on. With youth, one interesting area around cessation is, unexpectedly, now we have a lot of new youth who are addicted to nicotine. And our quit line is for individuals 18 and over, and it, has largely focused on individuals who have been smokers for a while. And so we're talking about how do we make sure that with our quit line and with our outreach, we're reaching those, unfortunately, whether it's youth or the young adult population that are now finding themselves addicted to nicotine. And there's other things we got to keep an eye on as well. So the other risk factors related to lung cancer is important. As we keep track of screening data, we need to better understand who we're reaching and who we're not. And also we need to continue to keep an eye on what happens with e-cigarettes and whether or not with e-cigarettes, we very much look at it as an on-ramp to nicotine addiction. And I think we need to continue to look at it in that way, especially youth initiation. But as the literature evolves, if we find out that it may be helpful for those long-term nicotine users, we need to keep our minds open to that as well. I want to make sure everyone's aware of healthydelaware.org as a resource with all of the information that I just talked about today. I know our governor is here. Joe, is he ready, or 1 minute? So, any questions for me about where we're going in public health, and any suggestions for us of where you all would like our team to be focusing? Nope. Well, I see our governor now in the back of the room. And it is truly such a great honor for me, especially in this forum, to get to introduce someone that you all know and respect so well. Governor Carney is clearly a health advocate, and he has been steadfast in his work around cancer for quite some time. I'll say several decades, but I don't want to. I was going to say I don't want to. Since he was 18, he's been focusing on cancer, and that includes tobacco control efforts. It includes environmental causes. It also includes a focus on disparities, where we as a state have been able to make great progress. And we are so grateful to our governor for his leadership role this past year in helping get Tobacco 21 passed, which we know is going to have a huge impact on health in our state and future cancer. So please join me in welcoming Governor Carney.